and welcome to Health Q channel, the health awareness channel where our mission is to motivate you to look at the brighter side of the hair. Coming to today's video, we are going to talk about facial exercises, in particular about stroke patients. Bell's palsy related facial exercise and stroke related facial exercise can vary to an extent because the cause is absolutely different. Bell's palsy is a lower motor neuron lesion, which means the damage is happened to the nerve outside the brain. Stroke is an upper motor neuron lesion because the damage has happened inside the brain. So the treatment and the symptoms that appears would be totally different. Today's exercises is for someone who is having facial paralysis due to stroke. So make sure you watch me till the end. Whenever you are having facial paralysis related to stroke, muscles would be much tighter. You will feel a kind of increase in tone of this muscle. You will have speaking difficulties, you will have swallowing difficulties, and you will also have some drooling problems. Although the upper side of the face would be spared, that means your eye movement will not be hampered, forehead movement wouldn't be hampered, but your facial movement, especially related to your mouth or else lip, would be impacted. So the exercises that we are going to discuss in today's video would be focused only on your mouth. So the first exercise that we are going to do for your facial paralysis is to activate your lip muscles. The aim here is to first relax your muscles as much as possible and then focus on the strengthening. So in order to relax the muscle, especially the spastic muscle, you need to create certain level of free movement. So if you have to create a free movement of your mouth, what you need to do? Simply hold your hand and just try to bring your both the lips together. You should not apply any resistance at this point. You just have to guide your hand and bring your lips together, making a pout. One of the first aim of a stroke related facial palsy patient should be the center of your mouth. This should be always in the midline, which means you should have this area in the midline. It shouldn't be deviated on any of the side. So due to stroke, if it is deviated on any of the side, your aim should be to bring this in the center. Now, in order to do this, the second exercise is you have to bring your cheeks towards the lips. What do I mean by this? You have to take the help of your hand and bring the cheeks towards the lips. You can also use one thumb or your index finger to do this exercise. Moving to the third exercise, the way we did this movement, we need to open our mouth and do the similar movement. How to do this? So here we are trying to bring the deviated mouth again back to the center. Similarly, you have to do for the lower lips as well. Moving to the next exercise, keep a finger in front of your mouth and try to push your fingers with the help of your lips. For the next exercise, take a paper or else a tissue, just keep it in front of your mouth and just try to blow the air. You can also take pieces of small papers, keep it in front of you and then try to blow it, something like this. Similarly, once your ability to blow the air improves, you can then switch over to trying to blow a straw later on, followed by blowing a balloon activity. Don't immediately start ballooning activity for your mouth, since your muscles would be weak. Moving to the next exercise, for this you have to open your mouth as wide as possible and hold it for 5 seconds. In this activity, you can give some support of your hand if you feel your paralyzed muscles are not able to withstand this position. You can do this for 4 to 5 times. One thing you should keep in mind while doing this exercise, this activity should not cause any kind of pain on your muscles. That's why if it is hurting, reduce the amount of the mouth that you are opening or else give support with the hand. The next exercise is take out your tongue and stretch it out as far as you can and hold it for 10 seconds. In between, if you feel your mouth is getting dry, you can definitely take some sips of water. Next exercise, stretch out your tongue absolutely out and then move it upwards towards your nose. And then bring downwards. And the last exercise is moving the tip of the tongue on the corner of your mouth. You can do this exercise again for 5 to 10 repetitions. So friends, these were some of the exercises that you can do for your stroke related facial paralysis. I hope you found these exercises helpful. If yes, make sure to like this video, share it with your friends and family members, and don't forget to subscribe. See you next time. Bye bye.